Our traditional understanding of pain was that it was related to tissue damage, actual tissue damage. So that if you had a little bit of tissue damage, you'd have a little bit of pain. And if you had a lot of tissue damage, you'd have a lot of pain. Now, the more kind of contemporary understanding, the more that we do work in this space, and this is not my work, this is work of lots of great people before me and before us, the more we sort of understand that, hey, there's so many things that influence pain. Context is really important. So, you know, if you have, sometimes the example we use, if you're military and you're in a war and there's a IUD, explosive that goes off and you get shrapnel in your shoulder, but you could also die and you've got to get to a helicopter for safety, you're not going to experience pain in your shoulder at that moment. You're going to be focused on survival, that fight or flight response to get to the helicopter, to get to safety. And then eventually when you're in safety, you might then feel your shoulder after. Whereas if you're just walking and, you know, I don't know, you have a traumatic injury to your shoulder, but you're in a safe environment, your life's not a threat, your system, your brain will prioritize, okay, well, your shoulder is bleeding and there's damage there, so I'm going to produce pain. So this gets into a little bit into the neurobiology, the understanding of how pain actually is created. And I suppose the key message, without delving into it deeper, which we can, is that we used to think it was all to do with an issue in your tissue or some damage to your tissues. But now we understand that there's a whole lot more processes that occur from when your system, your nociceptors or the receptors in your system notice a change in your periphery, which will then get, that information will get relayed up to your brain, and your brain will decide on the context of where you're at, past experiences, your beliefs, what you've been told, inflammation levels, stress levels, sleep levels, so on and so forth, and then decide, okay, should I produce pain or should we dampen down that response? Should we modulate that response because we've got other things in our hierarchy that are more important? A couple of good examples of this that I often use with patients to explain this process, that pain doesn't necessarily equal damage, are things like pulling the cuticle off your thumb. So if you like pull the little bit of the skin off your thumb, or you have a paper cut or something, is there much damage there? Not really, but it can be pretty bloody sore. So you have high pain, but not really that much damage. And on the converse side of that, I'm sure people would be familiar with these mystery bruises that just pop up. They might have hit their knee on a chair or kicked the side table or something, and they have these bruises that pop up and they're like, I don't actually have any recollection of how that got there or doing that specific action, but I've got clear evidence that there's tissue damage. You know, there's internal bleeding that's causing that bruise, but it's not painful. I'm not more bothered by it. More examples are things like a headache. Headaches can be really painful. If you did a scan of your head when you have a headache, are you going to see any damage? Probably not. What causes a headache? Well, maybe it's stress, maybe it's low sleep, maybe it's not enough water, maybe your nutrition's poor, maybe you've got tight muscles in your neck, those sorts of different things. And then finally, probably another good one is phantom limb pain. You know, people that experience pain in a limb that's not there. So after amputation, they might have ankle pain. After a leg amputation, they might have pain in their ankle that they used to be there, but it's no longer there. There's no way that you could have any sort of nociceptive input from that ankle, but you still feel that, and that's still a very real experience based on pathways and, you know, if we want to get technical, neural networks and cortical matrices of that pain experience. And we call it a pain experience because it's a whole body kind of experience. It's not really that clear cut as related to where you feel the pain as being the issue. It's a bit more holistic and whole person than that.